Good evening, everyone. Welcome you all for one more session of the Facebook Live. This is Dr. Praveen Gangadhara, consultant at Dr. Mohan's Diabetes Specialty Center, Malleshwaram branch. So I think most of you would have, following the page, would have known about the topic, that is today's topic, diet and diabetes, debunking the myths. We'll have a general overview and some of the questions which generally are asked during our consultation. I think again, if people are having any doubts, we can have a discussion. I'll try to answer as much as possible. But before that, I'll kind of give you a brief overview of in general about few terminologies and few things which is important when we talk about diabetes, or when we talk about diabetic diet. We all know that I think diet is definitely one important pillar apart from monitoring your glucose and medications. Diet is a very important pillar to in managing your diabetes. In fact, when people talk about food as medicine, it is extremely apt in case of diabetes, because definitely diet, whichever stage you are, whether you are pre-diabetic or already diabetic, diabetic on medications, or diabetic on insulin, your overall calorie intake, and especially one important factor, what we speak is carbohydrates, is extremely important in overall management. So when I speak about carbohydrates, I think that is, in simple terms, is your energy fuel. Many times when we have a casual discussion, when I say we need to cut down or reduce your carbohydrates, the first thing and foremost people tend to tell is, so I don't eat any carbohydrates. I've completely cut down carbohydrates. By their terminology, what they mean is they're basically cutting down on. They say that I don't eat rice, but I switched over to wheat or any other form of cereals like millets or any other ragi, rava, whatever it is. But I basically tell them that it's little difficult to be without carbohydrates. In general, when we talk about carbohydrates, all your cereals includes carbs. Again, that depends on whether they're simple, complex. Even your fruits have your carbohydrates. But generally, that is your energy fuel. And if you take an average across country, it's again a myth saying that generally in South India the carbohydrate intake is more, or basically rice is more. But even wheat is a form of carbohydrate. So if you take a average amount of carbs which we take, it's anywhere around 70-75% uptrend. Out of 100%, your carbohydrate is around close to 70%. So whichever form of cereal it is across country. So that is what we tell in general when we talk about not only just diabetic diet. Even a normal person can also reduce their carbohydrate, because there are a lot of benefits in reducing your carbs, and you can incorporate your healthy carbohydrates. So we expect that percentage to be anywhere around 50%, 45 to 50%, whichever is sustainable to you. But again, what constitutes carbohydrates? I think all that what I said. Okay, rice, wheat, ragi, rava, your millets, everything forms your carbohydrates. So there is general discussion saying, okay, this is a high glycemic food, glycemic index. These are the terms you would have technically heard. Glycemic index. This is little high glycemic food. This is a low glycemic food. But before we interpret what is glycemic index, glycemic index is a term we use where we tell that how fast any food goes up quickly in reference with glucose. So glucose, or your simple sugar there, that has a glycemic index close to 100. So your reference number is your glucose. So when compared to glucose, when you talk about white rice, it's around 69, 70 plus in, sorry, 79 in fact. If you talk about the white rice, you talk about wheat, it's more or less 60 plus you get there. So again, when you talk about glycemic index, more or less, even including some of the millets, have a slightly higher glycemic index than white rice. I'll come to the point why millets can have a higher glycemic index than rice. So don't just look at just the glycemic index, because that is like looking at one way of looking. Okay, let me look at only glycemic index. This food glycemic index is 50, so that's great. This glycemic index is 80, so let's avoid that. The idea is, when you look at glycemic index, there's also other terminology what we call as glycemic load. So what is glycemic load? It's nothing but the amount of carbohydrates into your glycemic index. When you divide it by 100, you get a terminology called glycemic load. So there can be certain food where your glycemic index can be slightly high, but glycemic load is on the lesser side. Again, when you talk about glycemic load, you classify somewhere less than between 10 to 19, less than 10, and more than 20. High glycemic load food are those which are more than 20. So, for example, if you talk about watermelon or even carrot, this maybe having a slight high glycemic index, but again has a lesser glycemic load. So that is the other important factor. Again, the way you cook, what you take along with your cereals plays a very important role. And this is one important point which I generally stress even during when we speak to our patients and during our consultation. I say, yes, you cannot completely change a cereal or completely avoid it, but when you're consuming something with a high GI, you can somehow moderate it by adding few things. That is maybe your protein in the form of if you talk about the vegetable source, the legumes, sprouts, or any vegetable for that matter. Because whenever, even though a food, for example, if you talk about white rice, again, if you can reduce the quantity, where if you say rice is my staple, white rice is my staple food, obviously the first choice would be brown rice. So what is brown rice? Nothing but when the white rice is intact with its bran and the fiber content is intact, the polishing is not done. Obviously, you call it as the brown rice. So just because a rice is brown in color doesn't mean you call it brown rice, because there are a lot of rice which is said to be brown, red, or whatever the name you give it. But what matters at the end of the day is the polishing and whether the bran is intact. Obviously, you cannot go to every market and do a microscopic survey and see whether it is there or not. But one other easy way to solve it is, one is your quantity, so how much you're taking, and second is whenever you had, make sure you include something. So if 50% of your plate has some amount of rice, make sure there's 50% of vegetables, your sprouts, or if you're a non-vegetarian, you can think of adding egg white, chicken, fish. So some lean meat or some protein going in will kind of blunt the response because of this, what you call as a glycemic response, or the glycemic, how fast it goes up. It kind of blunts. In fact, many studies have shown that in the early morning, when you can include some amount of protein in your breakfast, in fact, that protein impact can have its positive effect even during your lunchtime. Your glycemic response actually is slightly better. And thanks to today, we have the continuous glucose monitoring devices. So these are not hearsay or in my experience. It's more because what we see and when we monitor and way people respond. And again, as we keep telling, each body is different. Each person's response to these foods are different. But in to cut a long story short, what is more important is any cereal. It's again depends on so many other factors. So just don't look at glycemic index as the only parameter. You need to look at the glycemic load, which incorporates your the amount of carbohydrates, and whatever be the carbs, if you can include a good amount of protein or vegetables along with it, even a high GI food in a mixed meal, the response may be almost similar. So even a high GI food can have a better response when you include the vegetable content. Second thing, we did speak about the polishing, and I did mention that millets also may increase your blood glucose level. So when I mentioned that, I'm not here to go tell against, okay, all millets are bad. But the problem, what happens is, even the millets can be polished. And when we talk about millets, again, we know this. You have various types of millets like foxtail, barnyard, kodo. If you talk in local language here in Kannada, we talk about navane, same, odalu, araka. So these are some of the millets which they use. But the major concern is, again, when you consume millets, it's important. They are also a form of carbohydrates. First thing and foremost, again, these millets also can be polished. And whenever millets are polished, their response is more or less uh, equal to rice, that is white rice. Because I will not talk about brown rice, the glycemic index is as good as 53, 54. So when you talk about millets, a polished millets can increase your blood glucose levels as equal to white rice. So this challenge of saying whether polished or unpolished may be one problem. But even when you consume millets, it's important to include good amount of vegetables along with it. So that's the mistake what we try to make, because we assume that, okay, I'm consuming millets, so it's good for me. I can consume I can have three roti made from this millet. I can consume more than four rotis. Again, you'll have chutney along with it. which is not going to serve the purpose. Again, instead you can still have a brown rice with a lot of vegetables that may actually be better off for you. And first and foremost, it's not a mandate that okay, I'm my staple food is rice. I need to switch over to millets or I need to switch over to wheat. Whatever is your staple food, whatever is available locally, that's extremely important, because when we talk about any form of diet, sustainability is very important, and to sustain these things, you need to do something which you can do it daily. It's not that something you do it for a few days and you stop it. So first of all, make sure, okay, if your rice is your staple food, make sure can you switch over to brown rice, and whenever you're having white rice, can you slightly bring down your quantity of the rice consumed, can you increase the vegetable quantity along with it. So that is something which needs to be taken care. Second thing, again, when you think of doing with even with your millets, make sure you include more amount of vegetables, and try not to mix multiple millets, again, because when overall your calorie content can go up, try to stick on to one millet. And again, any form in general, when we talk in diabetes, we tell that whenever you eat, make sure you're able to chew well and eat. Don't try to swallow or make porridges, because when you make porridges, again, it's a common habit here, early morning, so you skip a breakfast or you skip your coffee, tea. Instead, you think that having any of this health millet milkshakes or millet liquid diet is good, is more healthier. But the point is, if you compare the amount of calories a 200 ml of this milkshake, so the health mix may have with along with when compared with a coffee or tea, is much higher. And you don't stop it there. You have this, and again at 10:30, 11, you tend to have your regular breakfast. So it's almost like a double breakfast. The amount of calorie taken is also double. So all these again plays a adds on to your, actually when you monitor your blood glucose, you tend to understand, God, okay, in fact, just I had just a drink with along with breakfast, but the postprandial sugars would have been 250, 260. So again, other way to understand is when you're on a continuous glucose monitoring, and you try to understand better. In fact, when you come back and give us a feedback, okay, doctor, this food is working well for me. That's the advantage of being on a CGM, because sometimes we go with an open mind. We don't give you the stringent rule saying that you need to follow X, Y, Z. You need to follow. We can give you an outline, but the way you want to mix match and what to have at what time depends on your overall physical activity, your requirement, and the timings. But what we do understand is whatever you eat, make sure when with every serving there is a good amount of protein or a vegetable in it. More or less, the response is taken care. And the third thing is adhering to the part of 3 meals plus 3 snacks. It's not a rule that everyone needs to have a 3 meal, 3 snack pattern. You're a diabetic, I need to have 3 meals, I need to have a 3 snack. So uh, again, when you say that, it's a challenge, because I agree that some of the older medications or somebody who was having brittle diabetes where they're having hypos, we can understand of having a mid-morning snack or a bedtime snack. But some of the new medications where the chances of hypoglycemia is very minimal, there is no necessity to keep eating at. I had 3 idlis in the morning, then have one more idli at 11 o'clock, then again a fruit or a fruit meal at 11, then again lunch. You don't have to keep snacking, because again your overall calorie intake goes up, and again that can impact your blood glucose levels. Okay, so finally I'm getting some questions here, so let me go through that, and I'll okay, there's a first question from Mr. Sukumar Gurumurthy. I'm taking cornflakes with little milk for breakfast. Afternoon, vegetarian lunch with vegetables and curd. Night, I take 2 dosas or 2 chapatis. I take 3 to 4 cups of coffee without sugar. I'm insulin dependent of most of my age, 72 years. My calorie intake will be less than 1,200 calories. So the thing is, this is the other common thing which we hear: morning breakfast, rather than having, if you're able to manage within 1,200 calories, that's great. But sometimes with these packed foods, the packed, you get the muesli and whatever, the cornflakes and other thing, please try to go through your food labeling, because they may say no added sugar, no added preservatives. But again, you need to see the carbohydrates per 100 grams. And sometimes some of the few personal experience from the CGM readings, we do see that levels can go up. So if you stick on with cornflakes with milk, that's fine. But again, you finish this and again have your regular breakfast, then it doubles up. But again, with the cornflakes, make sure there is some, if they're adding some sprouts or some sort of nuts there, because nuts are your healthy fat, so nuts can kind of again negate your the glycemic response. And milk is again you'll have some fat there, healthy fat there, so that also can help. So if, as long as it's doing well, and but I would definitely ask you to keep a watch on your postprandial sugars, because it's kind of, it can go up if your carbohydrate intake is more. And again, before this cornflakes, if you're adding on with some biscuits and tea, again the levels can go up. And a very good point you mentioned about the coffees, because this is something which just goes under the carpet. Because every time we say, okay, just 200 ml, 100 ml, I'll have one coffee before, early in the morning, then after breakfast, then around in the evening, then or again in the afternoon or whatever. So again, a 60 calories, 60, 45 to 60, again depends on the quantity and what you all. The main challenge we have with coffee is without sugar is fine. But again, if you include the so-called sugar-free biscuit along with each coffee, your calorie intake again goes up. So definitely no biscuits. If you can reduce the frequency to twice or thrice, would be better. But again, this depends on your HbA1c, sir, because 72 years, you're saying I would be quite happy with around 7%, 7.5 without low sugar. But again, as long as your levels are good and your readings are great, it should not be a problem. But if HbA1c is 8.59, frequent fluctuations, then we can definitely relook and tweak your diet. Definitely, there's some amount of protein missing there. Two dosas, two chapatis. Either you want to include some sundal there, or you want to have some vegetables, or that is something which is more important than the cereal portion. There's one more question coming in. Ayan Adda, can I use Ayurvedic medicines like Karela? Oh, okay, the first obvious thing is I'm definitely not an expert in that. But having said that, the native medications like your Karela or the fenugreek seeds, if you can use it part of your diet rather than buying them as powders or any other form, if you can use part of your diet or like a functional food, the even studies have shown an A1C reducing capacity of 0.2, 0.3%. But again, when you talk about 0.2, 0.3, depends if your HbA1c is 10%, and if you're thinking, if I just drink Karela juice or Karela vegetable, that's not going to help you. Definitely, please use not only Karela, include all your vegetables in your diet. That will definitely help your HbA1c. Karela alone cannot push the mountain or bring down your HbA1c by 2 or 3%. So it's kind of balance what is required. Okay, there's a question from Mr. Sanjay Gandhi. Some words about dry fruits. Okay, so when we talk about dry fruits, it's important we are more specific when we talk about the nuts. Nuts are extremely healthy. And that's the other common myth. We think that, okay, when we talk about nuts, I'm specifically talking about raw cashews, walnuts, almonds, to some extent pistachio, not the salted pistachio. I'm not including the raisins. I'm not including the anjeer and other dry fruits. So among that, definitely you can include your the nuts. And I mentioned here about raw. There are studies about the raw cashews, not the salted or the roasted cashews. These are healthy fats. Healthy fats would definitely improve your HDL cholesterol. There are studies which have even shown that it slightly lowers your systolic blood pressure. But definitely, when we do follow up, we do see nuts definitely helps. But again, when you talk about nuts, it's important these are not salted or roasted. And second, you can have a handful, maybe a mid-morning snack or something. Rather than snacking a biscuit, nuts are a better alternatives. And maybe at a mid-morning, if your lunch and your breakfast and your lunch, the gap is pretty wide. Maybe a mid-morning snack of nuts are extremely good. Raisins definitely can increase your raisins, and your other dry fruits can increase. Maybe quantity once in a while, one or two would be fine. But nuts is something which you can include daily. All the nuts which I mentioned now, you can definitely include in your diet, and as definitely healthy fats has a beneficial effects not only on your lipid parameters, also on your overall your cardiovascular health. Yes. So people were talking about nuts. I think there are a lot of, because when we talk about nuts, especially we speak about the cashews, there's a general consensus, okay, my cholesterol will go up or it's bad for my heart. But majority studies and meta-analysis have shown the beneficial effects from our, not only just from our center, even most of the global landmark studies we did. It does definitely seen some benefits, especially for your heart. Fix. I think the quantity should be important. I mean, definitely rich in overall the nutritive value is great, but quantity is very important. One or two, maybe in a week. Not again. Again depends. See, again, when we talk about any of those food which has to be restricted, depends on the baseline HbA1c, your overall control. Because somebody who's doing really well, 6.57, which is generally we talk during the mango season. So we generally ask whether I should avoid mangoes. So just before your mango season, your HbA1c is 6.5, 6.8. Definitely you can relish your mango. Just because it's slightly a high GI fruit doesn't mean mango is bad. Mango does have other nutritional benefits. So almost a similar principle applies when you talk about any other dry fruits you can definitely consume, even including a lot of people during the fasting try to break their fast with the help of dates. Dates has a good beneficial nutritive value. The iron content, your other minerals are rich in dates. But quantity and the frequency can be need to be reduced, especially if your levels are high. Once in a while, in a weekly, once or twice should not be a problem. But definitely, other nuts can be more frequent. Okay, there's one more question from Malati Ravindran. Okay, doctor, what is your view about eating sweets and chocolates? So I think a lot of people this quarter, when they come for follow-up, I've told that on an average, you have seen a weight gain of around 1 to 1.5 kg, thanks to the holiday season or the festivals. This is a common thing which we come across. Yeah, I had this festival, this had come, we had. So definitely we are nothing against eating sweets, but again, in moderation. I think, again, as I mentioned, if you are maintaining overall good control, you have a festival today, you have probably had a sweet in the evening time, try to balance it with your next meal in the next couple of days. Don't try to take it every day. At the same time, today's festival is there, you're eating a sweet. I'm going to say, please don't have sweet at all. You're diabetic, you're not supposed to eat sweet. At the same way, going for the so-called, again, the word called sugar-free sweets. I wouldn't definitely rather have a proper sweet moderation. You like a ladu, half ladu or one-fourth ladu, maybe in the evening time you like. Worst case, probably you have eaten a full ladu. Make sure you monitor your levels. Make sure, again, slightly increase your physical activity. That is the same thing when we take, even when you're on a holiday, you have those great buffet spreads, you try to eat. Try to increase your physical activity. So something you do around 10k steps in a day, try to do 12 or 13k that day. The next meal when you're eating, please reduce your carbohydrate, increase the vegetable content. So that is one way of tweaking your diet. Second is dark chocolates. When you talk about chocolates, some chocolates like dark chocolates are good, but again in moderation. In general, the saturated fat in other chocolates are definitely high. And please look at any food. Please look at the food labeling. Just don't go by the terminology of sugar itself. Just see per 50 grams or per 100 grams how much carbohydrate it has. Some of the well-known chocolate brands, if you see, will have 18 grams sugar. So that's almost equal to having more than 6 to 8 teaspoons or even more than 10 teaspoons of sugar in it. So you need to consider the overall labeling. Once in a while, dark chocolate, once in a while, chocolate is fine. Sweets also, as I mentioned, during the festival season, definitely you can have, but it's not saying that strict no. But somebody's A1C is 10, there's a lot of fluctuations. Again, sweet can add on to the problem. So it's important you monitor your levels. I think the other alternative for sweets is you can think of fruits if you're okay. But again, there is a habit for many people after their lunch or their dinner, they tend to have just a 1/4 of a sweet. But if they have it every day, those 1/4 adds on, and it's like a credit card interest. You would probably doubles up more than what you would think. Right. There's a question from मिस्टर इनाम सर फॉर हार्ट फेलियर पेशेंट जो टाइप 2 डायबिटिक भी हो उसके लिए इंसुलिन थेरेपी बेस्ट रहेगा या ओरल हाइपोग्लाइसेमिक एजेंट्स ओके नॉट रिलेटेड टू टॉपिक मिस्टर इनाम बट आई ट्राई टू हेल्प आउट बेस्ट अभी हार्ट फेलियर के बारे में बात करेंगे तो इंसुलिन सेफ है लेकिन डायबिटिक टैबलेट ड्रग्स में नहीं पूरा नया टैबलेट्स है, जैसा अभी SGLT2 इनहिबिटर्स बोलते हैं, जो शुगर कंट्रोल के साथ आपको हार्ट फेलियर को भी benefit रहेगा. Actually, these drugs actually help you for your heart failure also. Again, both your diabetic doctor as well as your diabetic physician as well as the cardiologist is the best person to judge. अगर आपको इंसुलिन के साथ ये टैबलेट्स चाहिए नहीं चाहिए, लेकिन ऐसा नहीं है कि हार्ट फेलियर है तो सिर्फ इंसुलिन पे रहना है. इनफैक्ट ये नया ड्रग जैसे मैं बोला SGLT2 इनहिबिटर्स या गेम चेंजर्स फॉर स्पेशली आप हार्ट फेलियर कंसिडर करेंगे. Okay, there's a question from Madhusudan. Okay, Madhusudan's joined. Okay, my regular follow-up of these sessions. So really glad that Madhu has joined. Sorry, doctor, joined the session now. Not sure if covered this. Can diabetics have ragi? If yes, what is the frequency in what form? It's one of my favorite questions. So the other question we did see that even the ragi, which is generally the staple food here, and the finger millet dumpling or the ragi mudde, what we call, is more of everyone's favorite. In fact, moment you're diagnosed with diabetes, the free advice or the free message you get across, right from family members to all the people who are diabetic, is stop rice and switch over to ragi mudde or ragi malt or anything from ragi roti. But the point is, as I mentioned earlier, good that you brought out this topic, and I wanted to focus on ragi. Ragi, in fact, the paradox is, I've seen, again, this is not with my experience, it's with the CGM. When you monitor with CGM, the people who consume 3 times ragi, you would see the spikes being pretty up and down. And there's a study from our own institute, from the MDRF, and they've shown, again, ragi also actually having more fluctuations. The GI index of, again, if you talk about the ragi, again, eaten isolated, ragi mudde definitely has a higher, more fluctuations when compared to even white rice. Almost 82, 83 was the GI index of ragi mudde. So again, what I would say is, somebody whose food is ragi, definitely I would not encourage ragi malt, because again, that's the glycemic load goes up, and even you do see those sudden spikes and fluctuations with the malt. I mean, malt in any cereal for that matter. But ragi mudde, if you want to make sure the quantity, the ragi ball is a smaller size. Have a ragi ball, have a lot of vegetables or soppu, whatever is generally taken here. Or if you're a non-vegetarian, if you want to include some egg whites or something, that is one option. Make sure you people tend to swallow ragi mudde. They don't chew well. So try chewing it if possible, though it's not the correct way of, for at least for all the food lovers. That is one way. Other thing is, don't mix up. Okay, I had ragi ball, swalpa rice, again, again, you double up the cereal portion. So instead of that, increase the vegetable portion. Okay, first time I had with the green leafy vegetables, you want to add something else, you can do that. So maybe if the frequency is twice, there are people who eat 3 times ragi ball, make it once, change the cereal, and again increase the vegetable portion or the protein content. The other forms is definitely not the malt. The other form is, you can make a ragi idli. Again, don't have chutney, prefer some sagu there with vegetables, or again, prefer a sambar over chutney. Other is ragi roti, but again, no, chutney is the ideal, the tastier option. But if you can have some bhaji or sabji, would be better. Again, just because it is ragi roti, please don't have 3 to 4 ragi rotis. Depends. I know some people will come saying that my house ragi roti, the size is only hand size, but again, it's extremely relative. So if you can balance it that way, it should not be a problem. But considering ragi as an healthier alternative than rice is not the correct thing. That is also other form of carbohydrate, which, when again not taken with vegetables, can definitely have higher fluctuations or a higher GI when compared to white rice. Okay, there's a question from Mrs. Neelam Sharma. Can we have sugar-free sweets? So yeah, I spoke about the sweets. I just forgot to speak about sugar-free sweets. In fact, sugar-free sweets, because to compensate, some of them use the artificial sweeteners. Somehow the calorie content and the saturated fat content goes up to get the taste. So I would rather not endorse these sugar-free sweets, because we don't know what the content or what the sweetener or what compensation has been made. Instead, you can, if your sugars are under control, and if you feel that one-off I need to have, a little quantity of normal sweet is any day better than the so-called sugar-free biscuit. So I go with a disclaimer, and except water, nothing is sugar free. So overall, you need to look at the calories there, and you look at the carbohydrate content there. And let's be practical. It's again saying this no, that no. You may probably nod your head while during consultation, and then we know the reality is outside. So there is temptation, and we all have the temptation to have something, but moderation is the key. There's one question I think I missed out. Sir, I'm Shankar Babu. I'm having diabetes and want to become a bodybuilder. Is it possible? Uh, Definitely, Shankar Babu. I think therapy, having diabetes should not be uh, what we say, a limitation for to become a bodybuilder or be a sports person. There are a lot of type 1 diabetes people who run marathons, and there are a lot of people who do it. So that's not a limiting factor. Obviously, you need a little bit assistance when, obviously, with right from treating your diabetes to keeping things under good control, your protein intake and overall other exertion has to be taken care. But you need to be we need to be more specific, and little better attention is required. But just being having diabetes doesn't have any limitations in being a bodybuilder, or whatever sport you want to be part of. Okay, there's a question. My HP or the hemoglobin is from Achama Wilson. My hemoglobin is 10.5. Can I take dates? Again, when you do, it's important to work up what is the cause for anemia. When you do just looking at HB 10.5, you should look at whether the cause, we do a complete hemogram, you will know whether it's an iron deficiency, or along with a blood picture, you would know what the cause is. The commonest deficiency, which we come across, is the iron deficiency anemia. You do get a microcytic hypochromic picture, common reasons. And if there is iron deficiency, dietary form, again, no diabetes, dates should help you. Some of the vitamin C rich food can enhance iron absorption. So you can definitely include a bit of Mosambি, orange, guava, kiwi there, which will enhance your, if you're talking about iron deficiency anemia, because these things will increase your iron absorption. Again, cut down on tea and coffee, which can again interfere there. Other iron-rich foods, the meat source also. If you're a non-vegetarian, you can think of the meat source, green leafy vegetables. These are some things which can be replaced in your diet. And obviously, the cause has to be worked up. If there is loss because of menstrual cycle or any other loss, it has to be the cause has to be found out. And if it is not an iron deficiency anemia, if it is of other cause, then the cause has to be treated accordingly. Yeah. So again, there's a question from Madhusudan. Yeah, for vegetarian, do you recommend having the whey protein around 20 grams per day for a daily protein intake? Yeah, we as vegetarians find it difficult to meet. That's true, partially true. Obviously, if the egg white comes in, it becomes easier. But without egg, vegetarian source, you do have soya there. You may think of the lentils and all the Bengal grams, green gram, but paneer. But sometimes you may not meet the daily requirement. I'm not exactly sure, because the people who go for these for gymnasium and gym, they do ask this question about the whey protein. I think if it's the only source, it should not be a problem. But again, there's my personal knowledge, protein and all the supplements you get, and what all the other added components which are there is a problem. If it's a pure whey protein, it should not be a problem. But again, as much as when we talk about medicines, we talk about a lot of natural things. But how much natural you can go in the supplements, you can keep that as a first priority. Maybe if you're not able to meet the daily demands, then definitely just the protein should not be a problem. But again, don't go excess even with your protein there. That also can have some of the negative impact. Since you spoke about the protein, the other common question is the protein powders, which people tend to ask, especially vegetarians. So some of the protein powders are okay, but again, as I mentioned, make sure when we prescribe any of the proteins, again, some of the protein powders do have the other form of sugars like maltodextrin, sucralose, apart from the protein and the fiber content in it. But make sure what happens is when you prescribe this, sometimes you go with the labeling, say 4 teaspoons, 5 teaspoons. So you can use this as one as your meal replacement. So you are just replacing 4 or 5 scoops and you have it with milk or warm water. Milk is preferred probably because of the fat, healthy fat there. That's a different story there. But again, if you have this as a snack, 3 to 4 scoops in the evening, then again that will add on. Apart from this, you add on with some more evening snacks. Then again, your definitely the blood glucose levels will go up. So if there is an indication, definitely your protein intake is not up to the required recommendation. Then definitely you can add on this. But again, make sure you discuss with your doctor, see those contents, what it is, what is the artificial sweetener there, again per 100 ml how much protein and how much carb is going in. Again, what is an ideal time to take this? Please don't have this and again have 2 biscuits along with it. So biscuits should not carry on as the add-on snacks with every sort of whether it is coffee, tea, or these protein shakes. But you can have in moderation, maybe 1 or 2 teaspoons should not be a problem, especially in the people who are pure vegetarian and find it really difficult to meet the protein requirements. Since I'm talking about the biscuits, one thing which I want to make things clear with respect to biscuits is, again, please go through the food labeling. Don't go again with no added sugar, no added preservatives. Every biscuit, some or other form, even if they don't use maida, even if they form with the oats, atta, and whatever it is, if you look at the per 50 grams or per 100 grams, you would get a good amount of carbohydrates there, a good amount of saturated fats. Majority of the savories and everything would be preferred in palm oil oil. Not that palm oil oil is, but again the quantity there. So definitely per 100 grams. I recently went through an ad which has biscuits has some ashwagandha and some sorts of seeds. And please have your seeds in as isolation. If you're looking for flax seeds or anything, you can have it as an isolation, not with biscuits. And what is the quantity of oats or seeds which is being impacted? Because for biscuits to bind or even to have a proper to biscuits to be as biscuits, definitely you need some amount of refined carbs going in. Otherwise, biscuits won't behave like biscuits. And just by coating biscuits with either ashwagandha or whatever seeds, it's not going to improve your nutritive value. So one of the easiest way to gain weight is to add on these any form of biscuits, 3 to 4 biscuits. If you can include with your tea, definitely you will gain weight. You'll also increase your sugar levels. As much as possible, try to avoid it. Once in a while, maybe when you're traveling or you don't have any other option, rather than having snacking some bhaji bonda there, 1 or 2 biscuits should be okay. This is again as a rare scenario, and a lot of people use biscuits as a savior during low sugar. That's also again a wrong thing, because when we again talk about low sugar, it's important. The common strategy which many people tend to do is early morning before they go for a walk. They think that because they'll go for a walk, their blood glucose may drop, or they may have a bad hypoglycemia. So early morning they may have a glass of milk or water with 2 biscuits. So if your fasting glucose is 90, 100, and you're on some of those medications which won't cause hypoglycemia, first of all, please monitor your sugar levels before assuming that it is low sugar. And we need to understand diet is greater than your exercise in the sense, what you may think you may go for 3 kilometer walk or a 4 kilometer walk would hardly burn around, if it's normal walk, it would hardly burn around 40 to 50 calories. A brisk walk maybe around 80 calories. So what you're snacking now with this 2 to 3 biscuits would actually spike up your levels by another 20, 30 points. So you look at 90, you feel that, oh, it may drop to 70, but actually post this, your levels would have actually gone up to even 130, 140. If you probably follow a CGM readings, you would understand that even how these couple of biscuits may actually kind of spike your levels. So unless indicated, first of all, biscuit is not the treatment for low sugar. And low sugar, the so-called the first alert value is below 70 milligram per deciliter. Less than 55, you're on insulin. Yes, a glass of milk, or in case if a hypoglycemia is confirmed, direct sugars or your glucose or your sugar is what is recommended to be taken, not your biscuits or chocolates, because these are healthy. There's a lot of fat in it, and obviously, and when we talk about low sugar, it's an emergency. So you need to prefer those things which are simple sugars. So 3 teaspoons of glucose or 15 grams of glucose is what is given, not the biscuits. Some people do carry while going for walking, but do not be really worried if you're not on some of those medicines which will not cause, or if your diabetes is not very brittle, like in type 1 or LADA or FCPD, where you would find a lot of brittle sugars. You don't have to keep snacking or being worried about low sugars. You need to kind of adjust your dosage or insulin based on your levels. But don't just snack a biscuit assuming that you would have low sugar. You can always carry the dextrose tablets or direct sugar if you find taking sugar everywhere. I mean, the other question which I think Madhusudan also has asked is for low sugar dates, dry grapes, fine should be used as immediate remedy. So that's the important point. So when you're looking, first of all, confirm whether it's low sugar. So obviously, some people who are experienced, you would know when you feel those symptoms, you feel yes, you can. But if you're at home, I would definitely recommend you to cross check whether it's below 70. Don't look at 100 and start snacking. That is not low sugar. And if it is below 70, the choice is glucose or the normal sugar what's there at home. So around 3 teaspoons, because these are simple sugar and this will increase your blood glucose levels immediately. And it's important you cross check again after 15 minutes, because if it is still around 65, 68, you can repeat the process again. You can again have a 3 teaspoons and again recheck, because some of the medications, especially the older sulfonylureas, are long acting. And longer acting sulfonylureas, the impact of low sugar can be long lasting. So in spite of replacing with sugar, the blood glucose may be little low. You repeat it again with 3 teaspoons, it may still remain low. Maximum 3 to 4 times you can repeat it. If it is still below 70, then you require medical attention. Sometimes you may have to give a IV dextrose, or if you have the glucagon kit, the hypo kit, that is one option. But glucose or dextrose tablets or sugar is your immediate relief. Dates, dry grapes, or sugars. So once the level picks up above 70, you can think of giving that. But definitely sugar is your go-to choice if your blood glucose is less than 70 milligram per deciliter. There's a question from Hema Malni. How many eggs can a diabetic have per week? The whole egg. So you can like apple a day keeps a doctor away. Definitely you can have a deal. At least one whole egg is around, I think, 75 to 80 kilocalories. You remove the yellow, it becomes probably 45 to 40 calories. So if you think of egg whites, you can have probably two, but definitely you can have one whole egg. Yellow is not as bad as it was considered. You can have, but the overall calorie. So if you're planning a 1200 calorie diet or a 1000 kilocalorie diet, I'm expecting weight loss, then definitely I would prefer egg whites over the whole egg. If weight is not the constraint or the calorie restriction is not a problem, then whole egg is not a problem. Daily you can have at least one egg, whole egg you can definitely have. Days you're not eating eggs, please replace with green gram, Bengal gram, or any form of protein which you're comfortable. There's one question again from Sukumar Gurumurthy. Will you please define a balanced diet intake for South Indian vegetarians? So great. So that's a nice question, and that almost kind of even can summarize what we expect for. This is not only again for diabetes in general. Even people who are non-diabetic also can do it. So in general, our carbs is around 65-70%. Our protein is as less as 10-15%. The fats are almost again 10% there, and remaining is your fiber. So what I would suggest is, or not only in general, the recommendations or what we need to practice is restrict your carbs to 45 to 50% if you're able to sustain it. Anywhere around close to 50 is good, max 55. Then the second should be your healthy fat, that is around 20-25%. Obviously, the source maybe your the nuts, seeds, and other things, but again, from your oil, whatever you're using, you would get your source there. The next important part is your protein. That should be around at least 15 to 20%. Healthy fat again has its benefits, but again, in vegetarian, probably you may not be able to get it through all your dietary source. So slightly increase your protein part there if you're able to keep it at least around 15 to 20%. Remaining can be in the form of your fruits and the other minerals you can get. But this may more or less, this proportion of keeping carbs around 50 and remaining with healthy fat and protein should be your base. And in a simple way, if you talk about a breakfast now, if you're thinking of 2 dosas in the morning, make sure there is, in a vegetarian form, make sure there's a bowl of sundal or a vegetable there. Have some sambar with dal there. So that's some way of tweaking there. Afternoon, you're thinking of having a rice meal. Make sure again 50% is some poriyal or whatever the bhaji you make there. So that is something which we need to tweak. And again with dinner, make sure you again include some vegetable serving there. And sometimes when we talk about vegetables, people consider including the vegetables in the sambar that I've included some vegetables in my sambar, so that serves the purpose. So in fact, when we talk about vegetable or any sort of bhaji you're making, you need to make sure that, or palya, what we call here, and we need to have a good amount of, the palya should fill 50% of your plate. Remaining is all your the cereal portion there. Other way to even decrease your satiety is obviously have some salad or some soup beforehand, so that your overall cereal consumption comes down by 10-15 percent, and that kind of helps you not only for your diabetes but also to manage your calories better. Other common queries and common thing, which probably coming to the last part of our discussion, I think, there's one question, sorry, I missed out from Mr. Avinash Rao. Is replacing sugar by stevia helpful? So there are a lot of artificial sweeteners, but stevia, sucralose, these are some of the safer options. So these are much better options when compared to in terms of your calorie intake. So stevia is definitely okay. But again, when you think of there's other common question is, I have coffee with jaggery, brown sugar, or what is this, honey. So nutritive value, these may be better, but more or nutritive value, your things are better, but calorie wise, they're all the same. So stevia is definitely a safer option. Foods to increase HDL. I think you've asked me in person also. So good that you foods to increase HDL. I think one is, see, we need to understand by exercise increases HDL, but food wise, if you see, it's your nuts, in again raw cashews, walnuts, almonds can increase your HDL. Exercise will also can increase your HDL, but again, Asian Indians, if you see the mean HDL, you would see 30, 35 plus. Very rarely you see the 40 plus. And again, if some people are on statins, which are extremely important to lower your non-HDL, LDL, and total cholesterol, your HDL also can be on a lower side, but doesn't mean that you need to stop the statin just like that. You can obviously compensate by increasing your fish intake or the nuts, that would, or your seeds, the flax seeds, and that also can increase your HDL. But you don't have to. It's more important to lower your LDL to your target value than increasing your HDL. Yeah, slightly increased HDL will definitely have advantages, but if it's around high 30s and close to 40, that should not be a problem. And just looking at HDL alone is also not a right method. Since you spoke about HDL, we talk about LDL also, in the sense the bad cholesterol. The other form of diet is obviously high protein, high fat, high protein, zero carb diet. That is the other extreme. You do have different names for it, but again, not sustainable. Long run, immediately, obviously, you would find very good results in terms of improving your blood glucose levels. But again, if the fat consists of more of saturated fats, definitely there will be an uptrend in both in your total cholesterol as well as your LDL as well as your non-HDL. And when we talk about cholesterol per se, moment you talk about cholesterol, you would think of two things. One is the non-vegetarian food, and second is people think about the oils. So I use this oil, I use that oil. So that's one important topic. So more than the oil, what is more important is it's not about using olive oil or what you call as use these cardiac friendly oils. Oil per se, what is more important is the quantity you use. In the sense, if you're having the overall quantity, 4 members in a family, probably you can think of using 2 liters. Again, see the quantity what you use per your food. Avoid reusing the oil. In fact, when you look at oil, you need to look at the parameters in terms of your saturated fat, your PUFA and MUFA, as well as the N3, N6 ratio. So rather than complicating it, the best way is mix up. You can use your traditional oils. When you talk about the traditional oils, it includes your groundnut oil, gingerly oil, and sometimes just sticking on only with sunflower oil also is not great. In fact, there's a positive association with metabolic syndrome as well as we talk about sunflower oil. Canola oil is great, but again, the best way is mixing oils also helps, but overall make sure the quantity of oil what you use is more important rather than the type of oil. In fact, each oil has its benefits. So if you can rotate the oils in your kitchen, this month you used groundnut oil, next time you're using gingerly oil, that also should be okay. So rather than using one type of oil, there are people who, again, you get some oils which are blending of two types of oil. That is also more or less okay. but reusing and the quantity is what is important. Because again, when we talk about this saturated, unsaturated fat, when you talk about now oil, you talk about fish. Fish is great. Fish as a curry is great. You talk about fish fry. Again, the the overall the saturated fat can go up. That can impact your lipid profile. So these are some things which we need to take care. And more than the diet, sometimes it's from your savories, all the evening snacks, which can actually increase your the silent increase in your all these other parameters, be it your sugar or your increase in your cholesterol levels. So you need to obviously keep a check. Have this awareness about, just don't go blindly with your the terminology of any sort of zero trans fat, zero sugar free, and no added preservatives. Please try make it a habit every time now you visit a supermarket or something. Make it a habit of looking at the food labeling. So it should not become a too theoretical that you go for shopping and you start doing this, but at least have some basic understanding that per 100 grams, and this is the carb which is getting in, this is the saturated fat. What are the contents there? I know it may be initially difficult, but probably make notes of it. Maybe when you're coming for your consultation or when you're meeting your dietitian next time, you would obviously get a better this thing. But just don't go with over the counter saying, okay, this is zero sugar, zero fat, this is more or less okay. So these are some things which have to be considered when you look at any of these packed foods. There's a question from Mona. Living in USA, there's a diet chart to download for Indian food. See, the problem is, I basically, more than believing in a diet chart, it's important how much overall, you're looking at the overall your dietary recall, what are your comorbidities, or whether what is your idea there. Are we planning a diet for diabetes, or are we planning for weight loss? So these has to be tapered. So based on that, you do get a lot of charts online saying, okay, 1200 kilocalories, so and so you can eat. But sometimes it's very important. We need to tweak based on your overall food pattern and what is available locally there, and so that tweaking has to happen. A lot of apps and there are a lot of charts which is available, but again, as I said, it has to be individualized. So you can consult the dietitian and then dietitians, and then you can take it from there. Thank you. There's a comment from Pinkesh. Good lecture by the doctor, helpful. Thank you. Thank you for your feedback. Amritlal. Thank you. Probably last 5 minutes, I think we'll wind up while with whatever we discussed today. Any other questions? Probably you can put it here. But what I want to, the take home message here is, overall, as I mentioned, anything, and I think you know this, that anything and everything, good or bad, in moderation is very important, even if it is good. But the take home message here is, if you're having your, first understand that when you talk about carbs, it includes all your cereals. So just don't look at only rice as your carbohydrates. Everything is your carbohydrates. Where you cook, what you take along with this carbohydrates is an extremely important point. The amount of vegetable protein you incorporate with this carbs is very important. Other very important factor is the polishing. The problem is, you polish, then only you get the taste. So if the polishing is not there, it will obviously take a longer time for you to cook. Sometimes you may not like it. So polishing will again increase your overall your glycemic index or your glycemic response. So lesser the polish, any form of cereal, definitely it is better, because it retains your bran, it retains your fiber content, the starch content is lesser, so obviously it will be better for you. So beat any cereal, moderation is the key. Rice is good. If you think of, again, the other alternatives, your brown rice. Brown rice and parboiled rice are not same. Brown rice is your best rice, because brown rice, the glycemic index is around 53, 54. Again, if you consider millets, make sure you use a single millet or a maximum two millets. But again, in millet, when you're using a millet, make sure they're not polished, and again, include more of vegetables along with it. Third thing, millets are, yeah, they're a good substitute. So there's a comment coming there. Millets are a good substitute, but millets should be an unpolished millet. Millet along with lot of vegetables. Millet alone also can increase your sugar levels. There are certain millets where the glycemic index are slightly higher than white rice itself. So again, it's again a individual response, but a simple basic way of blunting your carbs is by including more of vegetables along with your food. This should be your take-home message. Third, but not the least, including your snacks. When you talk about snacks, as I mentioned, the sugar-free aspect, go through the food labeling, see what works for you. In simple, have whole grain, more lot of vegetables, reduce your refined portion. And in some people, with thanks to today the continuous glucose monitoring, it's kind of more than an experiment. You can see what exactly is happening. So if you want to try a certain type of food for a week, for 2 weeks you will be on a continuous glucose monitoring. You can kind of experiment with your food. You yourself will understand, okay, this I had poha today, I had hawlaki, this is what has happened. I had upma with a lot of vegetables, this happens. Only upma or the karabat what you get in the hotel, this is what happens. So you kind of get a overall picture what exactly is happening, and that will definitely help you to tweak your diet and also adjust your medications. And when we see these things along with your food, we also can get a better idea to have the correct medications and correct treatment to manage your diabetes better. Last but not the least, any form of diet, rather than what has worked for X, Y, or Z, it is very important what works better for you, which you can sustain it for a longer time. So let us not get into a peer pressure of saying this one followed this diet, this one they almost reversed this diabetes, or whatever terminology you want, remission of diabetes happened. So it doesn't work that way. Let us see what works better for you. But definitely, whichever type, whether it is type 1, type 2, or again in type 2, if you're pre-diabetic, if you're pre-diabetic or uncontrolled diabetes with insulin or tablets, diet is definitely a very important pillar in managing your diabetes. And among your diet, your carbohydrate intake and your overall protein and your healthy fat plays a very important role in controlling your blood glucose. So thank you once again for wonderful interactive session. Any more questions you have, you can write to us. You can put in the comment box. Whenever possible, I would try to reply that. Thank you.